built a telehealth company to build their team contents technology to bring educators from other parts of the country to underserved towns. So that's how I got into diabetes education. The company was founded in 2019. We went live fall of 2020. So what we do at My Diabetes Tutor is we provide virtual diabetes education, medical nutrition therapy, device training and support for people with diabetes. It's the future of metabolic health. It's easily accessible for patients, it's a scalable business and it's profitable. So my vision at My Diabetes Tutor is to make sure that people living in any zip code gets access to diabetes education and dismantle the barriers of distance, language and improve access. Just to summarize, most of our growth, the company was founded in 2020. Most of our growth happened later part of 2023, and we have grown to 60 plus certified diabetes educators working nationwide. And diabetes is a huge issue. It's like almost $500 billion diabetes crisis. 40 million people living in this country with diabetes, with over 1/3 of the population diagnosed with pre-diabetes who are going to develop diabetes. So diabetes education is found to be effective. Just going through diabetes education reduces the A1C by 0.73 points. But unfortunately, the utilization of diabetes education is very low. Only 5 to 6, 7% of the people in this country ever receive formal diabetes education. And the reason is access issue. 62% of the non-metropolitan counties do not have a diabetes education program. So I came with a solution, My Diabetes Tutor. We are bridging the gap with virtual diabetes care, and we are solving access issue. It's an accredited program, and the support is provided by certified diabetes educators. We are not a wellness company. We have CDCS, who are registered nurses or dietitians, certified, qualified to provide the education. And we support the providers. Providers have 10 minutes for a patient, and patients need hours of education. So we are helping the patients, and we are helping the providers, and we are also helping the insurance companies, because just reducing the A1C reduces the complications related to diabetes and brings down the healthcare cost. So it's a win-win-win. So at My Diabetes Tutor, it's better access, better outcomes. Over the last few years, we have over 9,000 patients who went through our program. So our A1C reduction is way better than the national average. It's like 1.6 drop in A1C just going through our program. And it's very easy for patients to enroll. We don't have to be tech savvy. It's nothing needed to download. So it's a one-click access, no barriers for the patients to use our services, and we have excellent patient experience. Over 99% of our patients say they would refer other patients to our program. We did like over 782 patient surveys this year, and it's fully covered by the insurance. Insurance companies pay for our services, and there's no cost for the patient. And we support multiple languages. So 40% of our educators speak foreign languages. And we are not a wellness company. We do the entire spectrum of diabetes, type 1 diabetes, type 2 diabetes, insulin dependent, pregnancy. We also have specialized programs for pediatric patients, pre and post-op pediatric patients. And we are launching the first ever pediatric diabetes education program this month. So our business model is very easy. VCs like us. We partner with FQHCs, who are the largest source of referral for us. With large health systems, we are partnered with Adventist Health, PHS in New Mexico, And payers, we get direct referrals from the health plans who search and find the high-risk patients and refer to us. And we have channel partners, pharmaceuticals companies promoting us. And the hot news is we got into partnership with DME companies, durable medical equipment. So we probably have very large companies who control 70% of the market contracted with My Diabetes Tutor now. That's going to be a success because when they get a prescription for a device from the provider, we are on the form, just a checkbox to go to MDT for the training. So we got into that, and it's a recurrent revenue model. It's patient are allowed 10 hours of education during first year. They come back the following year for 2 hours. So it's a recurrent revenue model, and the business is, the numbers are very easy. We collect $120 per hour for one session, and we pay $45 to the educator. The gross margin is around 61%. And we work mostly with Medicare, TRICARE, Medicaid, government payers, and we are guaranteed there's no risk of not getting paid. We all know once you submit a bill to Medicare, they pay the 21st day. And we get multi-channel acquisition strategies like referral from FQHCs, health systems, from payers, and with the pediatric launch, we'll be also getting into direct-to-patient, and we'll be active on peer support forums, targeting patients. We'll be doing some digital marketing. So why MDT is different is there are so many players in this market, like big players in diabetes space, but we are different. We are feasting on the Medicare, Medicaid, TRICARE, and rest of the people are on the employers market. So 40% of the people in the country are on the either on Medicare, Medicaid, or TRICARE. So the patients are much sick, and the service is much needed in that population compared to the employers market. So how we are going in 2026? Geographic expansion. So we have good presence in California. Medicare, we are seeing patients nationally. We have patients from over 25 states. Medicaid, we have a good stronghold in California. We entered Illinois and New Mexico market end of last year. We partnered with the largest health system in New Mexico, and we will be also expanding to 5 other states, Medicaid, mostly southern states, Alabama, West Virginia, Mississippi, all those southern states, and portfolio expansion, adding pediatrics program. It's something very new, innovative, and expanding our relationship with the DME. And we have good technology partner. Our program was company is built on Charm Health, and we're adding some AI to what we are doing. We don't want AI to replace educators, but we're going to have an AI chatbot, so patients can be engaged between visits, and that's going to increase our revenue because patients come back for the next year for the follow-up visits if they get engaged. So adding AI chatbot. So the company financials, 2025 we generated around 2.2 million revenue, and 26 we anticipate easily 6 million in revenue, and will be profitable by end of 2026. And our goal is to get to 29 million in 2028. The company was self-funded by me until 2023. I decided to open a seed round. We got half of the investors in the seed round were physicians, and one half was family office who invested, who knew healthcare business. And 2025, I closed my seed round and opened a CDC, was backed by VC, raised 3 million. And now we also have an open round on Start Engine. We have a campaign. We are selling preferred stock at 0.93 cents per share. And we are currently valued at 18 million for the share. The reason for success is I'm a practicing physician. The reason we are succeeding is I have the best team. So I built the best team right from day one. So my chief operating officer was the former CEO for ICNet system. They installed 1,200 software at 1,200 hospitals, and my CTO is the former CTO for MD Live. We have VPs who work for large health systems. So, and we are still looking for funds. If anyone, we are interested, if you are interested in investing, you could directly go to Start Engine and invest in us. We probably need additional 1.5 million in funding before we hit profitability. If you have any VCs looking to invest, it's easy for the VCs. You put in money, it's going to be profitable in a few months. So the funds will be used mostly for geographic expansion, product lines, technology, sales and marketing. Sales is huge, and on track for 12 million revenue in 27. Thank you.
Any questions? Okay, it looks like.
I mean, this is the fact that it's underserved and that you have a successful business model, I think is amazing, number one. How do you see now, for example, ChatGPT in health and Anthropic is coming into health? Do you see some level of disruption or impact into what it is that you're doing? Or
So I can answer that question. So just going through diabetes education lowers the A1C by 0.73 points. Our A1C reduction is 1.6. There's a reason why it's higher. So it's not a cookie cutter program. So basically, we do an assessment visit, which is done by a human. We individualize the education based on the patient's need. So having ChatGPT or AI is never going to replace what we are doing.
what I'm hearing is that humans like talking to other humans, and actually humans are accountable to other humans.
Of course.
Yeah.
Thank you.